Good morning, good afternoon, good evening to you all, and a very warm welcome back to our COVID-19 press briefing from here in the WHO Regional Office in Copenhagen, Denmark. A very warm welcome to you all. Very glad you could join us today. We are also honoured, of course, to be joined by my regional director, sat to my left here, Dr. Hans Kluge. He's going to be joined, and it's a great honour for us to welcome Mr. Philip Corrie today, UNICEF's Deputy Regional Director for Europe and Central Asia. We're very grateful to have you with us, sir, today. We'd also like to, and we're very excited to hear from Ms. Janeka Asatova, a teacher in Kazakhstan, who will be making a short statement after the Regional Director this morning. Just to remind you who else we've got on the panel before I pass the floor to Dr. Kluge. We have Dr. Richard Peabody, our team leader on infectious hazard management here in the WHO Health Emergencies Programme in Copenhagen. We're also joined by Dr. Siddhartha Datta, our Programme Manager, Unit Lead for Vaccine Preventable Diseases and Immunization, and a warm welcome also to Dr. Natasha Azapadi-Muscat, our Director of our Division for Country Health Policies and Systems. So without further ado, I will welcome you once again, and I will pass the floor to the Regional Director.
Thank you, Rob, and welcome everyone after the summer. The epidemiological picture in the WHO European region, comprising 53 countries, is mixed. We now have 64 million confirmed cases and 1.3 million deaths. 33 member states report a greater than 10% increase in 14-day case incidence. This high transmission is deeply worrying, particularly in the light of low vaccination uptake in priority populations in a number of countries. Several countries are starting to observe an increased burden on hospitals and more deaths. Last week, there was an 11% increase in the number of deaths in the region, with one reliable projection expecting 236,000 deaths in Europe by December 1st. Three factors account for this increase. The first is the more transmissible Delta variant, now reported in 50 countries in the region. The second factor is the easing of public health measures, and the third is the seasonal surge in travel, driving a significant growth in case numbers in most countries. We are seeing a particularly steep increase in cases in the Balkans, the Caucasus, and the Central Asian republics. We must be steadfast in maintaining multiple layers of protection, including vaccination and masks. Vaccines are the path towards reopening societies and stabilizing economies. Despite this, we remain challenged by insufficient production, insufficient access, and insufficient vaccine acceptance. In roughly 8 months, nearly 850 million doses have been administered, with nearly half of the people of the region being fully vaccinated. This in itself is a remarkable achievement. However, in the past 6 weeks, vaccination uptake has slowed down, influenced by a lack of access to vaccines in some countries and a lack of vaccine acceptance in others. As of today, only 6% of people in lower and lower middle income countries in our region have completed a full vaccination series. Even though nearly 3 in 4 health workers in our region have completed a full COVID-19 vaccine series, there are countries that have only managed to vaccinate 1 in 10 health professionals. There is a clear need to increase production, share doses, and improve vaccine access so that they may offer a full series of vaccination to populations. Everyone, everywhere, should have the right to receive the full course. Vaccination is a right, but it's also a responsibility. The stagnation in vaccine uptake in our region is of serious concern. Now that public health and social measures are being relaxed in many countries, the public's vaccination acceptance is crucial if we are to avoid greater transmission, more severe disease, increases in deaths, and a big risk that new variants of concern will emerge. Vaccine skepticism and science denial is holding us back from stabilizing this crisis. It serves no purpose and is good for no one. Public participation is vital for successful COVID-19 vaccination. Understanding people's perceptions, including their concerns regarding vaccine safety, helps countries to inform communities and healthcare providers where and when needed. It is imperative that health authorities look very closely into what determines vaccination uptake by population groups, and then establish tailored interventions at community level to boost vaccine uptake. Together with its member states, WHO Europe has developed pragmatic tools and guidance to identify and resolve bottlenecks in immunization programs, allowing countries to build on other countries' good practices. These tools are at every government's disposal. Increasing vaccine production, sharing these doses equitably, and driving vaccine acceptance and demand are the three fundamental elements needed to deliver on the promise that vaccination can move the European region beyond the pandemic. My final points concern children. Their schools must be open. School closures stall academic performance, increase the likelihood of children dropping out of education, and affects children's mental health. Our children have suffered greatly over the past 20 months, especially those who were already vulnerable and or could not benefit from digital ways of teaching. Unlike a year ago, we are now in a position to keep them safe. As millions of children return to school, WHO Europe and UNICEF call for all necessary measures to be taken such that schools are open and remain open. These include to implement vaccination strategy targeted at teachers and school personnel and to children above 12 as well, especially those with underlying conditions. Improve the school environment through clean sanitation and hand hygiene, ventilation, smaller class sizes where possible, physical distancing, masks depending on the local risk assessment, and regular testing of children and staff. And above all, protect children's mental and social well-being. Today, we are joined by Janerke Asetova, a language teacher in Kazakhstan, who understands these challenges firsthand. As we enter another school year, I am eager to hear how she intends to manage COVID-19 measures in her school and classroom. In closing, I wish to thank Janerke and all the teachers around the world who have had to navigate challenging times, but whom have continued to serve their communities and our future generations. Thank you.
Thank you very much, Regional Director. So on that note, I'm going to go straight across to Kazakhstan now, to Janerka, who's joining us on the Zoom link that we've established with her to share some of her opinions, insight, experience with us today. So Janerka, the floor is yours. Thank you for joining us. We're very grateful. Janerka, we can't actually hear you, Janerka. Sorry, you may be on mute. No, I'm afraid we still don't have audio at the moment. No, Janeka, unfortunately we don't have audio. We'll come back to you shortly. I'll come back to you. Instead, I will move on, if you'll allow me, Janeka. We'll come back to you in just a few minutes. If we can move on, I'm going to go over to UNICEF's Deputy Regional Director, Mr. Philippe Corrie, to make a short statement. As the Regional Director noted in his opening statement, WHO Europe and the UNICEF Europe and Central Asia Office today are jointly calling for schools in our region to remain open and be made safer from COVID-19. So I'm going to go over to Mr. Philippe Corrie. Mr. Corrie, I hope that you can join us online.
Yes, good morning.
Great.
Can you hear me?
We can. Please.
Perfect. So first, thank you to Hans and all the colleagues of WHO in teaming up for this very important call to reopen schools. And I'm looking forward to hear also Zanerke, because she represents quite a number of teachers who are on the front line. And I'd like to thank also, I see so many colleagues from the media, and thank you to WHO to allow us to address them. We need your help. It's very serious what's happening. The closing of school for 28 weeks as an average in Europe, Central Asia, and we have seen the Western Balkan, and up to and more than 1 year in some countries like Bosnia, North Macedonia, Turkey, is extremely concerning. It's basically a massive destruction of our social cohesion, of our societies on the long run, because it is affecting the most vulnerable children, the children with disabilities, living in rural areas, girls, migrant and refugee children from minorities like Roma. So basically 25 million children, particularly the most vulnerable children of our societies, have been absent from any form of distance learning over the last few months. So it's really something that is questioning ourselves. It's on the top of some close to 5 million children out of school already in this region. And we already know that more than 19 million children in this region were not even, when they were schooled, achieving the level of proficiency in math and reading prior to the pandemic. So it's a massive destruction in the making of our social cohesion and of our efforts in sustainable development, all the achievements we have been having so far. So a lot is at stake, and we need your help to convince government communities to reopen classrooms to our children, adolescents across our region. And we have worked with colleagues from WHO. We are, as you know, UNICEF is on the ground, providing support to governments with guidelines, tips, working with teachers, practically in terms of, and a toolkit has been developed in this regard to make sure that we are as practical as possible to facilitate proper conditions, healthy conditions for this learning. But this destruction of learning across the region and face-to-face learning is really, really a challenge for our society. So it's really important the face-to-face approach to schooling come back to our region. And this exclusion of any form of learning of the most vulnerable is really something that will be ultimately, quite a burden for our long-term cohesion and investment in social cohesion and social development. So therefore, that reopening is really something we need to convey, and it's important not only to support governments, communities on how to technically and practically ensure healthy learning. We have seen some good examples quoted by Hans, ventilation, the distancing in the classroom, and simple, of course, the washing of hands, and of course the mask when needed, and it's special attention to children with underlying conditions. So this is all possible. We need to re-empower to our parents so that they could support their children. And for instance, UNICEF has developed a parenting app that would give good tips for parents in these conditions and based on the age of a child. So we need to be very practical. We need to reassure. We need to work with teachers. We need to address vaccine hesitancy by explaining, not stigmatizing, explaining why vaccination is important. And teachers are very important in this regard. And we need them because they could also be the advocates, for vaccination. And so they need to be understanding how it works, why it is so important. And this work with teachers has been also very important for UNICEF in terms of their capacity to be online. You know, many of our teachers were not necessarily trained to be teaching and having curriculum online. So it was very important to work on this new approach. And we have now a new program called Learn In that is dedicated to teachers to be able to teach and follow the learning, the quality of the learning, the inclusiveness of the learning online as well, and do some kind of blend approach in terms of face-to-face and online teaching. So they are very much the frontliner as well for us, and they are key, partners that we wish to continue to support practically on the ground. So I'll stop there because it's so important to hear now Zanerke. I hope Zanerke can be online, but really the media support, convincing communities, government to reopen their schools, municipalities, mayors, decision makers, caregivers, to ensure that this school will be reopened in best possible conditions. And this, joint effort is only the way to move forward. So thank you so much. Over.
Deputy Regional Director, UNICEF, Mr. Corey, thank you very much for those words. I'm going to take those words and go to immediately over to one of our panel members to add a few comments shortly. Janerka is still trying to make contact with us, so we will come back to her in a few more minutes. We'll just give it a little bit more time. So I'm going to go over to the panel because quite a few of the questions have related to the measures what member states can adopt to minimize transmission in the virus from schools. Mr. Corey's just spoken to that. I'm going to go across to one of our panel members, Dr. Azzopardi Muscat, who's the WHO Europe Director for Country Health Policies and Systems, and ask Dr. Muscat if she could add a point or points regarding this question, because it's come in, Natasha, from a number of different journalists over the last 24 hours. Basically, what are some of the measures WHO member states can adopt to minimize transmission of the virus in schools? Maybe you could add a few points to what's been said. Thank you.
Thank you very much, Rob, and good morning. And perhaps just to start again, it bears repeating that schools are not isolated from the rest of the community. So now more than ever at this point, it's critical for all of us to do whatever we can to keep levels of community transmission down. And I would also just like to recall that a year ago to date, we had the first meeting discussing schooling, and it was a very different predicament and situation for all of us. Now, so many things have changed because we have vaccines available. And in many countries, teachers have been offered the opportunity to get vaccinated. Otherwise, we continue to call for teachers to be amongst the priority groups. For children who are given the opportunity to be vaccinated, also to take up this opportunity for parents to allow their children over the age of 12, if they are invited to be vaccinated, to do so, particularly those children who may be at higher risk. Of course, Hans and our colleague also from UNICEF have mentioned the importance of ventilation in countries where outdoor activities are possible, to continue to be able to do this so that we preserve extracurricular activities as much as possible too. Mask usage, this is often one of the questions that is raised. And as WHO, we have detailed guidance, but just also, if I may remind people that we are facing a Delta surge. Delta is highly infectious, and therefore it's important not to throw caution to the wind and to be very aware, particularly in areas, localities, and countries where there is ongoing transmission, to be able to use masks in the school setting where distancing may not be possible. And finally, also when it comes to testing and testing strategies, we've seen so much evolution over the past year in terms of the tests that are available, rapid tests, tests that perhaps are less invasive and more acceptable to be carried out on children. And over here, the importance also of judiciously using testing to avoid mass and blanket quarantines as far as possible, so as to be able to move towards more targeted quarantine of children who are truly exposed, so as not to disrupt education. We anticipate that there will be cases in schools because schools are places where children gather and come together. And therefore, the importance of not disrupting education through blanket quarantines, but using the quarantine appropriately and complementing this with testing. And finally, the importance of engaging the teaching community as well as children and adolescents in doing whatever they can do to keep transmission down. When we convened our high-level group on schooling that has worked really hard, and I'd like to acknowledge their work over the past months to be able to come up with these recommendations, we also involved the voice of school children. And it's incredible how much the children themselves can do if given the right information and equipped and empowered to take decisions to protect themselves. Back to you, Rob. Thank you.
Thank you very much, Natasha. Thanks very much. I'm going to come back because there's a few questions regarding schooling. But before I do, I'm going to go back again over to Kazakhstan shortly. But before I do that, there's a question we've received, and I would encourage you all to raise your hands, please, in the system, or write your questions in the chat function, the journalists joining us today. We have a question from AFP, from Camille Baswalat. I think this is to you, Regional Director. You said it will be some time before we can put the pandemic behind us. But what does it take to reach the end of the pandemic tunnel? Why is it taking us so long? Regional Director.
Thank you, Camille, and good to have you back. So there are a number of impediments which are in the way to achieve faster the 80% benchmark. So first, too many people remain hesitant to embrace either the vaccine or the public health measures. The second one is that too many countries still struggle to have access to the vaccine itself in our pan-European region of 53 countries. The third one is that too often countries believe prematurely that the pandemic is over while it is just a wave passing, and then they have to return back. And next one is that, in our regard, there is not enough effort or focus on the development of therapeutics in addition to the vaccine. But we also believe that we can overcome those with the following three directions. The first one, top priority, is to roll out the vaccination equitably. So uptake, production, and sharing of the vaccines, and to do this also together with the private sector. And it doesn't matter whether it's bilaterally or multilaterally. What's important, that countries with a surplus are not waiting too close to the expiry date. Because if then they are doing a donation to a country, it's very tough for everyone. So not to hoard on the vaccines. And of course, as I was telling, the top priority is to reduce vaccine skepticism while engaging, empowering the communities, and if need be, to consider mandatory measures for the most exposed population groups and professions. This is the first one. The second strategy is to implement what I call nuanced approaches within our pan-European context. And this includes, for example, expanding the vaccination programs to children and additional jabs. I think I was in the United States in August discussing with the authorities the transatlantic cooperation and discussing also with Dr. Anthony Fauci. And we had together the same, let's say, conviction that a third dose of vaccine is not a luxury booster taken away from someone who is still waiting for a first jab, but it's basically a way to keep the people safe, the most vulnerable. But at the same time, we need to share, so we need to do it all. And finally, very important, the third direction to get out of it is to maintain a proportionate pressure against the virus during periods of tranquility by not surrendering on masks, ventilation, mobility control, and intensified testing policies. And if I speak at a global level, pressuring the virus starts with sharing all our data. Thank you.
Thank you very much, Regional Director. I'm now going to try and go over to Kazakhstan to Miss Zhenerka Asatova, a teacher in Kazakhstan. Zhenerka, let's try again to see if we can hear you this time. Please go ahead.
Thank you. Can you hear me now?
Great, we can. Great to have you with us. Thank you.
Good afternoon, ladies and gentlemen. My name is Zhenerka. I'm a Kazakh teacher at Astana Garden School, speaking to you today from the capital of Kazakhstan. Thank you for giving me this opportunity to share my thoughts. Last year, when the world first faced COVID-19, I was at the beginning of my teaching career. It was a big challenge for all of us to ensure the continuity of learning in condition of lockdown. It was also challenging for students to adapt to the new reality, as not all of them had access to a computer device or the internet. This created an additional divide. You could call it a digital divide. Everyone suffered, teachers and students alike. It's amazing how quickly we all learned to adapt because we had no choice. If we didn't, our students would suffer. And education is the most important thing to help children realize their dreams. However, there came a new problem. Lots of students start to have mental health problems caused by lack of social contacts. Young people need to learn in a group environment so they can learn from others. I observed that high school students tend to be more stressed and frustrated, while junior students were happy to spend hours in front of computer playing the games we include in our lessons. Online learning has affected not only the well-being of the community, but also the quality of education. Students couldn't get an individual attention when needed. It was difficult for teachers to give an extended feedback. Kazakhstan offered the vaccine to teachers earlier this year, and I jumped at the opportunity because I know this would be the only way I could return to in-person teaching while keeping myself and others safe. Now, in just 2 days' time, schools in Kazakhstan are reopening after the summer holidays, and I'm so excited. I can't wait to teach my students directly, help them with their problems, and be a pillar in the community. Our schools are so important because this is where next generation of scientists, politicians, and writers are created. This is where dreams are made. We must support our schools to remain open, whatever happens. And the most effective way to do this is to get vaccinated when we can. All of us can do our bit to make sure next generation doesn't suffer the consequences of our actions right now. Thank you.
Thank you so much, Zhenerka, for this testimony and particularly for your professional commitment and your passion, as you also represent so many teachers this morning. We really appreciate it a lot, and very good luck. Thank you.
Thank you.
Thank you very much, Zhenerka, and thank you, Regional Director. We're going to go straight to the journalists now online, and I'm going to start with Esmir Milevic from N1 Bosnia. Esmir, good afternoon.
Good afternoon. The question is for Regional Director, and the question is, you just recently visited Bosnia and Herzegovina, but you also spoke today about the situation in Balkans, and that the situation in Balkans worries you. But what we saw over the last week or so is that the key politicians with whom you met here in Bosnia and Herzegovina, such as the Speaker and Deputy Speaker of the Parliament, but also member of the presidency, attended to the large events on which we saw absolute and total disregard of all measures, including not wearing masks and disobeying social distance and everything. And those events were from few hundred to few thousand people at the place. And also we had a situation where the spouse of the Deputy Speaker of the Parliament, Ms. Izetbegovic, is also a medical professional, and she attended one of those events. So what kind of message that sends to people in Bosnia and Herzegovina, and what we should do to change this situation, to lower the numbers in upcoming weeks? Thank you.
Okay, thanks very much, Esme. I'll hand that to the regional director first, and then I'm going to go over to Dr. Richard Pebbody.
Thank you, Esmir. And let me speak from a regional perspective that in countries where the incidence of COVID-19 is on the rise, and particularly if they're facing new waves, all the basic measures apply. Right? Keeping the distance, wearing the masks, hand hygiene, strengthening the health system, and definitely avoid large mass gatherings unless, of course, really very strict hygiene conditions can be put in place. Let me give you one example. Together with our governing body board, we have decided to hold our annual region committee. This is our annual governing board of 53 minutes of health. The 13th of September, we have decided to hold it virtually, exactly because of the epidemiological situation.
Thank you. Next, Dr. Pebbody, would you like to add anything to that?
Yeah, no, thank you very much. I mean, I think the points are all very well made. And of course, as we heard, one of the key issues driving the increases in transmission that we're seeing across the region has been the spread of the Delta variant that has happened over the summer months. We know this variant is more transmissible than the previous circulating viruses and is also associated with increased risks of severe disease, particularly hospitalization compared to the previous circulating viruses. So we do need to get back to the basics, as we heard, the proper implementation of the public health measures to reduce transmission in the community when we start to see increases in transmission. And of course, the increases in vaccine uptake in the priority groups to really provide protection from them from severe disease, from hospitalization and from other severe consequences. And we know that the vaccine still provides excellent protection against the Delta variant, against severe disease. Over and out.
Thank you, Dr. Pebbody. Next, thank you very much for the question, Esme. Next, I'm going to go over to Peter Kenny from the Anadolu News Agency. Peter, please, the floor is yours. Peter, we've got no sound at the moment.
Rob, can you hear me?
Yes, I can, Jamie. That sounds like
This
Jamie.
is Jamie. It's not Peter Kenny, but I'll take the opportunity to ask a question.
Jumping the queue. Brilliant, Jamie.
Thank you very much. Dr. Kluge, thank you very much for your presentation. I want to just make sure you mentioned your conversation with Dr. Fauci. Does WHO Europe also...
This is Peter Kenny here.
Well, now you're cutting on me,
Peter, if you could just wait a moment, we'll just hear Jamie's question, then I'll come back to you, Peter. Thank you.
Dr. Kluge, you mentioned Dr. Fauci. Is it your belief then that boosters are needed within Europe? I mean, because that's been an issue. So what is your exact stand on that question of boosters? And it sounds to me like, the WHO headquarters has been hesitant or has been talking more about the importance of vaccinating healthcare workers and the vulnerable and particularly impoverished countries. That seems to go somewhat against what you seem to be saying about a targeted implementation strategy on adolescents who, I think, if I can sort of maybe paraphrase what WHO headquarters has said, is that children are not as quite the high priority. So could you just address your policy on boosters and whether or not there's a slight nuance in your position against WHO headquarters in terms of vaccination of children? Thank you.
Thank you, Jamie. So to implement nuanced approaches within our pan-European context is one of the three strategies which I see to get out of this mayhem, let's say, towards a sustainable control of transmission. So we are fully aligned on the principle of equity. Everyone has really the right to get a full series of vaccines. But to start from the children, we need to keep the schools open. So if we look in the pan-European context, if the vaccines are available, then yes, the adolescents definitely have to be vaccinated, because otherwise, especially in the context of the Delta variant, we will face many more challenges. So absolutely. On the booster, we have to be a little bit careful, because there is not yet enough evidence. And I think that's where Dr. Fauci and me were discussing, that it goes towards, in fact, maybe the word booster is not the correct word, Jamie. We should say an additional dose, that this ultimately will be seen if the evidence evolves in that direction as part and parcel of a complete basic regimen, so that it's not taking away a vaccine from someone who is waiting, but basically an important instrument to keep particularly the vulnerable people safe. So that's where we stand. Thank you.
Thank you very much, Regional Director. Thanks for the question, Jamie. So I'll go back over to Peter Kenny. Peter, can we now?
Okay, thank you.
Thank you.
Thank you, Jamie, for asking my question. I would just like to know, Dr. Kluge, if you think that these additional jabs or vaccinations, whether the debate about this is going to confuse people about the whole system of vaccination, because people are saying in some countries it's time for a booster, in some countries are offering boosters. Could you explain something on that? Thank you.
Yes, Peter. This comes back not only to this question. No, we have been, we meaning countries, agencies, struggling from the very beginning. We have to be careful of making policy decisions within an uncertain context, or when, like in this case, the evidence is not available yet. So what's very important to keep the trust in science is to have transparent communication towards the people. Remember with the vaccines that there are about the side effects and other instances, so we learned the lesson. So we have to explain to the people that the evidence is not watertight, that the importance is do it all. I think this is the key, Peter, do it all, right? So there are more and more studies telling that a third dose, if previously it was 2 doses, keeps vulnerable people safe, like a number of countries more and more are doing in our region. But at the same time, countries need, as soon as possible, to share their excess doses. And we know there are. I have appointed a special advisor on the COVID-19 vaccination rollout already months ago. We have detailed lists of EU, Israel, UK, what's the excess, which vaccines, expiry date, and what are the needs in the other countries, particularly in the east of our region. And that's what we are doing, I'm doing on a daily basis. I call it target health diplomacy, speaking to presidents and prime ministers to share vaccines, and not only with the European region, but also with the African region and other regions. Thank you.
Thank you. Next, I'll go to Nikolai Skuzgård from Reuters. Nikolai.
Yes, hello, can you hear me?
Yes, please go ahead. Thanks, Nikolai.
All right, thanks. And just a follow-up question to the third jab. Are you guys in discussions with any EU or European states about the use of boosters? Are you sort of speaking to countries on a more detailed level about the maybe contextual use of third jabs? And then another question on the, and I don't know if this is something you'd like to speak to, Kluge, but on the origins of the virus, do you guys consider a lab incident in China a scenario that needs to be looked further into, also on the backdrop of this US report on the origins that recently came out? So yeah, what's your stance on looking further into the origins of the virus? Thanks.
Okay, thanks very much. Thanks, Nikolai. I'll first go over to Dr. Siddhartha Datta, who's our Regional Advisor for Vaccine Preventable Disease and Immunization on your first question, and then I'll turn the one on origins of virus to the regional director. So first, Siddhartha, please.
Thank you, Rob. I hope you hear me well. So thank you, Nikolai, for that question. In terms of our engagement with member states, yes, indeed. I mean, we use different mechanisms to, number one, understand the decision-making process that member states are making in their country for use of these additional doses. So I just wanted to highlight a couple of things here. A decision-making process in a country involves the participation of the National Immunization Technical Advisory Group of experts who look into the local disease epidemiology, the vaccine doses availability, the vaccine uptake at this point of time of the different population groups, and what are the evolving nature of the evidence as have been evolving, not only for this vaccine per se, but around the globe, what are the evidences being generated for this additional dose and waning of immunity and etc. As you have heard the regional director say, that any decision the country is making should be based on robust data, robust science, and robust evidence. And that is what we are also engaged with different member states. In terms of the European Union member states, we are also engaged with European CDC for their discussion around the National Immunization Technical Advisory Groups, where these decision makings are being discussed in detail. But WHO brings about the available evidence, wherein the member states can look into the local context and see what is the evolving nature of science around this topic. Thank you so much. Pass it back to you, Rob.
Thank you. And with the second question, we'll go over to the regional director.
Yes, Nikolai. So this effort is directly led by WHO headquarters and the Director General, who recently has established a special expert group to look into the origins of this virus, but also future novel pathogens. And at this stage, there is not enough evidence and facts. So I think we have to remember that to study the origin of a zoonotic agents takes time. This has been the case of MERS, has been the case of SARS, can easily take 1.5 years up to 2 years. It is not easy. So in that sense, I would say that it's very important to give this study its time and not to jeopardize it at this stage. And our exit point is always a good collaboration with the different partners involved, because that's ultimately why the United Nations were established. Thank you.
Thank you very much, Regional Director. So next, I'm going to go across to Jan Dirk Herbermann, who is a Geneva-based, German journalist with a number of different outlets. So Jan, I'm going to go over to you next. Are you with us?
Yes.
Thank you. Go ahead.
Can you hear me?
We can.
Can you hear me? Okay, great. Yes, Dr. Kluge, I have a question on vaccine donations. Do you know how many doses have been donated by countries of the region to other countries and to COVAX? And also, I'd like to ask you on the vaccine skeptics. You just said that vaccination is a right and also a responsibility. So what can be done to convince vaccine skeptics or to pressurize them into getting vaccinated?
Thanks very much, Jan. I'll go to the regional director and then back to Siddhartha. Thank you.
Thanks, Jan. Yes, we have a detailed inventory. Basically, the WHO Regional Office for Europe serves at what I call a matchmaking forum. So from both countries with surplus and in need, we have a good overview. And that's why I pointed the special envoy on that one. Of course, it may be that sometimes it takes a bit of time that if a country bilaterally decides to give donations, but we do have also, as you may know, 31 country offices. And that's what we use to try to equally have equity in vaccination rollout. This is it's what I call COVAX Plus. So it's complementary to the COVAX, but we also know that the COVAX ultimately will go up to 20%, and the target set by our expert group is 80%. That's on the first part. The second part, Dr. Siddhartha will go a little bit more in detail, but our principle has been not to blame the people, but to try to understand their perceptions. I think the key issue here from my perspective, is that still too many policies in countries are made based on perceptions, assumptions, and not on data. And that's why, among others, we established a special unit on behavioral and cultural insights. But with this for the details, Rob, maybe we can go to Siddhartha.
Of course, of course. We go over to Siddhartha Datta. Thank you, Siddhartha.
Thank you, Rob. And just continuing from the point where the regional director you left, we strongly feel that any decision that is being made by the country should be based on local data on vaccine uptake. And countries, as you have heard, the regional director mentioned in his opening remark, that the understanding the reasons behind the vaccination uptake will allow devising a locally tailored intervention. So that's number one. The second part is people may have questions, and I think this should not be seen as people being hesitant to receive a vaccine. This understanding of their questions or any question that they may have, any concern that may have, both on vaccines and vaccination, should be seen as sort of a health-seeking behavior of the population. This should be seen as their process of going towards an informed decision, an informed choice. And I think it's extremely important that the governments make effort to listen to, address them, and be prepared, so equipped themselves to answer those questions. And this is an extremely important element. Within the WHO regional office, as you have heard the regional director say, we have the Behavioral Cultural Insights Unit, one of its kind in the WHO, in the entire WHO, which looks into people's perception, why people would not be taking a vaccine, what are the different factors which are influencing their decision-making process. That's where WHO comes along, very context-specific again, to work with countries to find out and devise what interventions would work. And just one quick data that you requested, Jan, about the vaccine donation, just to give you a very quick summary that we have received from COVAX, that in the WHO European region, we have received around 7 million doses being donated from Sweden, from France, the United States of America, to our WHO European region, countries in our WHO European region. But overall, several countries have donated around 95 million doses to the COVAX for distribution. But this is over and beyond the bilateral numbers that are bilateral doses that are being shared by our European Union member states to the other countries. Thank you so much.
Thank you for the question, and also thanks to the regional director and Siddhartha for those responses. I'm next going to go over to Ancho Lamela from EFE in Spain.
Hello, can you hear me?
We can. Please go ahead.
Yes,
thank you.
Great. I got a question for Dr. Kluge. In your statement, you said that the high transmission is deeply worrying, and you mentioned the easing of public health measures as one of the factors. Denmark has had the epidemic under control for weeks or months. Face masks are not mandatory anymore. And last week, the Danish government said that they will remove all the restrictions in a couple of weeks. As the WHO regional office for Europe is based in Copenhagen, do you have any thoughts about that? Thank you.
Thank you. So a number of points here. The first one is that Denmark is a champion in vaccination uptake. There is a maximum degree by the population in trust in the vaccine, and which translated really in a very high vaccination uptake. Number one. Number two, the health system is capable to implement really a large-scale testing strategy, and it includes genomic sequencing. So, as the minister, Magnus Heunicke, was telling a couple of days ago, it does not mean that the country at one point may not have to go back and implement some more restrictive measures, but the target is that this would be done locally. So if you detect locally some outbreak, that then in that local environment, some more restrictive measures are being implemented without having to go to large scale. Having said that, we have to, like in any other country, this has to be followed very, very closely.
Thanks very much. Now, I'm going to go to two other panel members with this question. The first I'm going to go to is Richard Pebbody, see if there's any points you'd like to make, and then to Siddhartha. I'll ask you both to be brief, please. Thank you.
Thanks, Rob. I mean, not much to add except to flag that certainly Denmark has a very strong laboratory-based surveillance system in place, which at very high rates of testing for individuals with acute respiratory illness and also contacts as well. Consequently, that they're able to utilize that system to maintain levels of transmission at low levels at the moment, both in country and at the borders as well. But clearly that needs to be flexible. And if they do see increased levels of transmission, then as the regional director mentions, that would then need obviously tightening of public health measures accordingly. Over and out.
Thank you, Richard. Siddhartha?
Thank you. Just to outline the vaccination part of COVID-19 in Denmark, as the regional director has outrightly mentioned, there's a very high vaccination uptake across the population groups in Denmark. If we quickly look into the numbers, people more than 60 years of age, according to the data available with WHO, 98% have completed their cities, meaning either they completed their 2 doses. And adults which are under than 60 years of age, they have 76% of them have received a 2-dose vaccination series, so which is indeed a great reflection, not only about people's perception and trust on the government, but we also would like to acknowledge the effort made by the Ministry of Health and the government to ensure that they do get access to the information. The vaccination is being made convenient, and also ensuring that the community level based understanding of reasons what were holding some of the people back were then put into place so that there is increased coverage or uptake in the population group. So I think, again, going back to what regional directors say, do it all. Even if we do it all within the vaccination, it's no cherry picking, but we have to make entire system run behind to make a vaccination uptake successful. Great lessons to learn from Denmark indeed. Thank you.
Thanks for those responses. Thanks for the question, Axel. I understand, Jamie, you had a second question that we didn't get to. Could you please go ahead? Jamie Keaton. Jamie, you're still with us? No. Okay. Well, in that case, I'm going to ask the Deputy Regional Director for UNICEF, Philippe, if you have any comments you'd like to make before I hand the floor back to Hans to make some concluding remarks.
No, thank you very much indeed. I mean, it was very good to have this exchange with media and concerns. But I just put it in the chat box. I understand that people are concerned about the third jab or not, and where and how. But thousands of children are missing their regular vaccination these days. Polio is back, measles is growing, and nobody is that much mentioning that, this entire cohort of children have been missed in Europe and Central Asia. So this is extremely, worrisome because of the disruption of health services. So if media could also bring the attention that, vaccination is really to be continued, because this hesitancy, and therefore, as colleagues have mentioned, we should not stigmatize people who are hesitating. We should explain and try to bring trust back, because it could jeopardize, and we see already some effects, all the efforts and investment made in ensuring vaccination against preventable disease that we are used to do across Europe and Central Asia. So that if media could also stress that importance of getting, our children immunized as per their regular vaccination program that have been made available over the years and saving 2 to 3 million children per year in the world. This is what is at stake as well. Not only the third jab or not. So it's very important that we emphasize that aspect as well, so that health system be thinking in terms of their capacity of continuing and reassuring as well caregivers, parents, and community leaders around vaccination. So that's really what it is all about. And as Hans said, it's about, understanding people, studying as well behavioral insights. And in UNICEF, we have also a dedicated section on that to understand what is, the narrative that is blocking people to trust vaccination as they used to for their children before. So that's really, for us, also a dimension that we need to, along the school reopening, to emphasize. And thank you again to your interest as media and to our colleagues in WHO. Au revoir.
Thank you, Philippe. Thank you to you and the panel members for joining us today. A particular thank you to Janerka and to, really, as the regional director said, all teachers across our region, around the world, for their dedication and their contribution to our society, to our communities. They deserve our respect and applause. So a warm thank you to Janerka and all of them. It only remains for me to close the press briefing today. This press statement by the regional director made will be available is available online. It only remains for me to say, take care out there, and we'll welcome you back in the not so distant future for another press briefing on COVID-19. Thank you very much for joining us today.